This is the Pet Buzz.
This is the Pet Buzz.
And here's the Dynamic Pet Duo.
Hey, Dr. S. Hello and welcome to the Pet Buzz.
Thank you.
Well, Dr. S, why are so many pets fat? And is this a problem throughout the United States?
That's a very good question. So, as you know, it's basically an imbalance between energy intake and energy expenditure. The more food you consume and less exercise you have, that leads to obesity. So as you may know, in the United States, there are about 60% of the cats are overweight or obese, and about 56% of dogs are overweight or obese. And to answer your second question, interestingly, in places with a colder climate, there is increased obesity in the pets. And you could guess why that is the case, because they have very less amount of exercise when compared to other places where there is hotter climate.
Well, I never even thought about that. Did you?
No, I didn't. I didn't know that. As a sidebar, is there a comparison with people's percentages of obesity?
Yes. I was going through this, and that is an interesting comparison. The obesity rate in Colorado is really low for humans, whereas it's higher for pet animals. So I don't know why this is the case, but it's a very interesting thing to observe.
You know, that's really interesting because, you know, I go to Colorado a few times a year and I do some television there. And, you know, part of the lifestyle of most people I know who live in Colorado are outside, they're hiking. It's the same, you know what I mean? They're outside, they're hiking, they're with their dogs. They have multiple dogs. They have big dogs. And I don't see a lot of really fat dogs.
No, but the people should be thin too, shouldn't they?
Yeah, I mean, they're larger, but I get the impression that they're kind of healthier.
Wow, that's really interesting,
Yeah,
Doc.
it really is. Okay, so go ahead. You had
Well, talk to us about your research with the aging and the obese pets.
Okay, so basically we are interested in understanding how obesity through consuming high-fat diet would affect your brain. Because we know that with consuming high-fat diet, it not just affects your peripheral system, it also affects your central nervous system by producing oxidative stress and neuroinflammation. This neuroinflammation that's happening in the brain could in turn lead to increase in nerve activity, basically causing higher blood pressure. It puts so much pressure on your blood vessels, it increases the body's blood pressure. And as you know, with increase in blood pressure, it could lead to a lot of heart-related diseases.
Yeah.
Yeah. I mean, you know, it's bad enough getting old because then, you know, you have an older pet who's subject to dementia. So I guess, like, talk a little bit about, like, how that, I guess, the two, aging and being obese, really are, just talk, I guess, maybe a little bit more in depth about that, because I think that's like, I think that's fascinating. I mean, we're talking, you know, when we have sleep studies about aging pets and their brain functions, and now we have fat studies about aging.
I mean, interestingly, if you come from this perspective of obesity, to me is an accelerated aging phenomenon. If you're obese, then you're putting your body to an accelerated aging. You are getting older at a faster rate. So that's what we are seeing from our studies. So,
yeah, no, that's interesting because, you know, we've talked about this. So certain breeds age quickly or faster, like some small dogs. They appear to. So have you gotten into any like breed specifics or small dogs versus big dogs in terms of aging and obesity?
So basically, our studies are mostly in rodent animals. So we are trying to understand what's happening in the brain when they consume high-fat diet. That is one interesting phenomenon that's happening in the brain. That is increased number of senescent cells. These cells that undergo irreversible growth arrest. For a lack of a better term, we can call these cells as zombie cells.
Zombie
So these.
cells.
Yeah, zombie cells.
Another trendy word, zombie cell. Are they?
Right. So they are present in the brain. They are not dying, and they're producing more inflammation. They're affecting the neighboring cells, and all this could affect the neurons that control the blood pressure. So when there is increased nerve activity in the brain, that could lead to an increase in blood pressure. As you know, with obesity, one of the problems that could lead to is an increase in blood pressure, which is hypertension, or could lead to a number of diseases like arthritis, kidney diseases, diabetes mellitus. All of this could happen in the pets, right? It's very similar to what we see in humans too.
Wow. We're just like our dogs, aren't we?
Yeah. The bad thing is that which tastes good is usually not good for us, is it?
Exactly.
Oh.
Exactly.
I mean, for us, it's ice cream. For dogs, it's treats.
Yeah, but
and steak for you.
Oh yeah.
Yeah, you're a steak head.
Oh yeah. Oh yeah.
Yeah.
But what's really interesting is all the clients that I see coming in, all my patients, whether they're small or whether they're large breed dogs, they're all getting fat. Of course, COVID didn't help that at all either, I don't think.
No. Yeah. I guess.
I mean,
how much weight did you gain during COVID?
I did gain quite a bit of weight during COVID. But interestingly, since during COVID, since human beings are at home with their pets, I heard that pets got a lot more exercise than they usually get and less anxiety because they're always with their owners.
Mm-hmm.
Yeah.
Mm-hmm. And I'm glad you talk about exercise too, because people think if they have arthritis in their dogs or if they have heart issues with their dogs, they really don't think about exercise. And exercise is still important then because obesity will happen. Is that correct?
That is absolutely right. So obesity is a multifactorial disease. The main changes that you could do are lifestyle changes, reducing the amount of calories the animals consume and increasing their exercise is the best method as of now. Pharmacological interventions are just getting started, but there is not a clear intervention yet for reducing obesity in the pets.
I'll bet you that was the answer to my next question too, is how can pet owners combat obesity, especially with the older dogs, the older pets?
I mean, with the older pets, exercising is going to be tricky because they may not want to go out as much as the younger ones. So I would suggest reducing the amount of calories they consume, and then being with them, putting more attention to them will certainly help.
You know, one of the things I think, I'm going to interrupt you, is that I don't see it so much here in Florida, but when I lived in New York, I have to say, living in New York City, I lived in Soho, so I lived in a fairly affluent neighborhood, but there were fat pets, but not like it is here in Florida. And I really think that people, if they're concerned, should talk to their vets. But I also think vets need to bring it to the forefront. You know, Mrs. Jones, your pet is really packing on the pounds. I mean, and then, you know, the big scary thing for me is once you talk about the money, then they're willing to talk about preventative measures. Don't you think so?
Interesting thing that you brought it up. Almost 20 to 30% of the pet owners don't think that their animals are fat.
Oh, yeah.
That by itself is an issue.
Totally agree with
now,
that.
you tell people they're pet, you're too nice. Well, you know, I know you in a different way. But the reality is, do you tell people their pets are fat, or you kind of like dodge the ball?
No, I don't dodge the ball. I indicate to them that, especially with the aging pet, as doctor is talking about, that I want that pet to live a longer life with them, that they can enjoy that pet longer and that pet can enjoy them longer. And this gives them the opportunity to have that quality of life if they're willing to do some sacrificing. The problem is they don't know how to sacrifice the change in diet, for example. They don't have the abilities to change their own lifestyle like we're talking about, and them getting out and doing some walking too. So I kind of push them hard. and they look at me and they laugh because we laugh about it.
I mean, do you tell them that if their pet gets sick, and gets all these diseases, it's going to cost beaucoup bucks?
They're smarter than we give them credit for.
Oh, I don't
One of the
think
things
so.
that they'll ask me is my dog going to get diabetes? Right?
Of
So,
course.
yeah.
Yeah. I mean, no, I mean, I mean, I'm a diabetic. Okay. For me, it's hereditary. And yeah, of course, I've changed my diet, but I exercise as much as I can, whether I get stretched, walk, garden. I can dig a lot of holes in a short period of time.
I think that the pet owner with the aging pet is becoming more sensitive about this because they're recognizing they don't have a lot of time left.
I think for me, really, I think the approach should start with veterinarians when puppies come in, and veterinarians need to tell their clients, look, I'm so happy you came in and the puppy's so cute, but you know what? I need you to think about something. We need to take preventative measures so that during the course of your puppy's life, he's safe, he's healthy, and you're going to have a long last. And I think that needs to start with day one. I think you have a new mission.
And doctor, you also recognize that when you tell people about the adjustment of the nutritional levels and the nutrition that you're providing them, and you offer something else, like they won't eat anything else. This is all they'll eat.
They only eat roast beef.
I've tried so many different things, and it just doesn't work. Is that right, Doc?
It is absolutely right. So basically, I would suggest doing something like an intermittent fasting kind of approach for the pets too. Instead of providing ad libitum food, they should restrict the amount of diet that's given to the animals. That's the best way to deal with this obesity problem.
Yeah. Well,
it is the best way. I totally agree. This has really been an enjoyable conversation with you. And I hope our listening audience is paying attention to this. And we really do thank you so much for joining us today.
Yeah, and we'd love to have you back.
Please.
Thank you so much for inviting me.
Thank you for listening to this episode of The Pet Buzz.